Passive-aggressive behavior is the indirect expression of hostility, such as through procrastination, stubbornness, sullen behavior, or deliberate or repeated failure to accomplish requested tasks for which one is responsible. For research purposes, the Diagnostic and Statistical Manual of Mental Disorders Revision IV describes passive-aggressive personality disorder as a pervasive pattern of negativistic attitudes and passive resistance to demands for adequate performance in social and occupational situations. Passive-aggressive behavior often utilises malicious compliance, that is, veiling one's intent to not do something in performing the specific task in such a way that an unwanted result is caused. Concept in different areas. In psychology, passive-aggressive behavior is characterized by a habitual pattern of passive resistance to expected work requirements, opposition, sullenness, stubbornness, and negative attitudes in response to requirements for normal performance levels expected of others. Most frequently it occurs in the workplace, where resistance is exhibited by such indirect behaviors as procrastination, forgetfulness, and purposeful inefficiency, especially in reaction to demands by authority figures, but it can also occur in interpersonal contexts. Another source characterizes passive-aggressive behavior as a personality trait marked by a pervasive pattern of negative attitudes and characterized by passive, sometimes obstructionist resistance to complying with expectations in interpersonal or occupational situations. Behaviors: learned helplessness, procrastination, stubbornness, resentment, sullenness, or deliberate, repeated failure to accomplish requested tasks for which one is responsible. Other examples of passive-aggressive behavior might include avoiding direct or clear communication, evading problems, fear of intimacy, competition, making excuses, blaming others, obstructionism, playing the victim, feigning compliance with requests, sarcasm, backhanded compliments, and hiding anger. According to Living with the Passive-Aggressive Man, a self-help book, a passive man does little to get what he wants, as it is too much effort to do so, and ranges from the inept loser type to the conformist who does anything to be liked, avoids making waves, and rarely says what he feels. In conflict theory, passive-aggressive behavior can resemble a behavior better described as catty, as it consists of deliberate, active, but carefully veiled hostile acts which are distinctively different in character from the non-assertive style of passive resistance. In the workplace, passive-aggressive behavior from workers and managers is damaging to team unity and productivity. Warner, in the ad for his online e-book, says, "The worst case of passive-aggressive behavior involves destructive attitudes such as negativity, sullenness, resentment, procrastination, forgetting to do something, chronic lateness, and intentional inefficiency." Quote, "If this behavior is ignored, it could result in decreased office efficiency and frustration among workers. If managers are passive-aggressive in the behavior, it can end up stifling team creativity." De Angelis says, "It would actually make perfect sense that those promoted to leadership positions might often be those who on the surface appear to be agreeable, diplomatic and supportive, yet who are actually dishonest, backstabbing saboteurs behind the scenes." Passive-aggressive personality disorder. The World Health Organization's ICD-10 lists passive-aggressive personality disorder under other specific personality disorders. DSM-IV Appendix B. Passive-aggressive personality disorder was listed as an Axis II personality disorder in the DSM-IIR, but was moved in the DSM-IV to Appendix B because of controversy and the need for further research on how to also categorize the behaviors in A. Future edition. According to DSM-IV, passive-aggressive personality disorder is often overtly ambivalent, wavering indecisively from one course of action to its opposite. They may follow an erratic path that causes endless wrangles with others and disappointment for themselves. Characteristic of these persons is an intense conflict dependence on other and the desire for self-assertion. Quote, although exhibiting superficial bravado, the self-confidence is often very poor, and others react to them with hostility and negativity. This diagnosis is not made if the behavior is exhibited during a major depressive episode. It can be attributed to dysthymic disorder. Millons Subtypes. The psychologist Theodore Millon has proposed 4 subtypes of negativist. Any individual negativist may exhibit none or one of the following causes. Passive-aggressive disorder may stem from a specific childhood stimulus in an environment where it was not safe to express frustration or anger. Families in which the honest expression of feelings is forbidden tend to teach children to repress and deny the feelings and to use other channels to express the frustration. For example, if physical and psychological punishment were to be dealt to children who express anger, they would be inclined to be passive-aggressive. Children who sugarcoat hostility may have difficulties being assertive, never developing better coping strategies or skills for self-expression. They can become adults who, beneath a seductive veneer, harbor vindictive intent. In the words of U.S. Congressman, psychologist Timothy F. Murphy, and writer, practicing therapist Lorianne O'Bolin, alternatively, individuals may simply have difficulty being as directly aggressive or assertive as others. Martin Cantor suggests 3 areas that contribute to passive-aggressive anger in individuals: conflicts about dependency, control, and competition, and that a person may be termed passive-aggressive if they behave so to few people on most occasions. Murphy and Oberlin also see passive aggression as part of a larger umbrella of hidden anger stemming from 10 traits of the angry child or adult. These traits include making one's own misery, the inability to analyze problems, blaming others, turning bad feelings into angry ones, attacking people, lacking empathy, using anger to gain power, confusing anger with self-esteem, and indulging in negative self-talk. Lastly, the authors point out that those who hide their anger can be nice when they wish to be. Treatment. Psychiatrist Cantor suggests a treatment approach using psychodynamic, supportive, cognitive, behavioral and interpersonal therapeutic methods. These methods apply to both the passive-aggressive person and the target victim. History. Passive-aggressive behavior was first defined clinically by Colonel William Menninger during World War II in the context of men's reaction to military compliance. Menninger described soldiers who were not openly defiant but expressed their aggressiveness by passive measures, such as pouting, stubbornness, procrastination, inefficiency, and passive obstructionism, due to what Menninger saw as an immaturity and a reaction to routine military stress. According to some psychoanalytic views, non-compliance is not indicative of true passive-aggressive behavior, which may instead be defined as the manifestation of emotions that have been repressed based on a self-imposed need for acceptance. In the first version of the Diagnostic and Statistical Manual of Mental Disorders, DSM-I, in 1952, the passive-aggressive was defined in a narrow way, grouped together with the passive-dependent. The DSM-IIR stated in 1987 that passive-aggressive disorder is typified by, among other things, fail to do the laundry or to stock the kitchen with food because of procrastination and dawdling. Increased public exposure to the term has led to websites like Passive-Aggressive Notes, which uploads purportedly passive-aggressive emails, notes and signs, although many of the examples are not correctly passive-aggressive in nature. Bibliography. Cantor, Martin, Passive Aggression, A Guide for the Therapist, the Patient and the Victim, Westport, CT. Prager Publishers, ISBN 0-275-97422-7, retrieved April 27, 2010. Wetzler, Scott, Living with the Passive-Aggressive Man, Simon and Amp, Schuster, ISBN 9781451640175, retrieved April 27, 2010. Oberlin, Lorianne Hoff, Overcoming Passive Aggression, How to Stop Hidden Anger from Spoiling Your Relationships, Career and Happiness, Perseus P. 45, Feminia, N. and Amp Warner N. The Silent Marriage, How Passive Aggression Steals Your Happiness. Nicholas James Long, Jody E. Long, Signa Whitson. The Angry Smile, The Psychology of Passive-Aggressive Behavior in Families, Schools, and Workplaces. Pro-Ed. ISBN 9781416404231.